I am Dr. Purna Chandarao Nayak, working as an associate professor in the Department of Oral Medicine Radiology. So today we shall have discussion about bisecting angle technique and its projections. So basically bisecting angle technique, it works on the simple geometric theorem, that is Szyszynski's rule of isometry, which states that two triangles are said to be equal when they share a common side and having two equal angles. So here the film is placed as close as possible to the teeth on the lingual surface or the palatal surface of the teeth. So now the long edge of the tooth and the plane of the film will form a triangle by joining at their apices. So now an central X-ray beam should be perpendicular to the imaginary bisector, which bisects the angle formed between the long edge of the tooth and the plane of the film. So same principle will be implemented in the patient's oral cavity. So during this procedure, there are some angulations which need to follow, vertical angulation and horizontal angulations. So these angulations are different for different teeth according to their position and inclination and the length of the tooth. So in case of maxillary, always the vertical angulation should be positive in order to compensate the axial inclination. For incisors, it is plus 40 and canine it is 45, premolars plus 30 and molars it is plus 20. And for mandibular teeth, always the negative angulation, that is for incisors minus 15 and for canines minus 20 and for premolars it is minus 10 and molars it is minus 5. So same principle now we will be going to demonstrate in the patient's oral cavity. Now let us have a demonstration on the patient about bisecting angle technique and different intraoral projections. So basically before making an exposure, there are 7 fundamental rules or steps to be followed. Among them the first one is always greet and make the patient seated. Among the 7 fundamental steps, the first step is greet and make the patient seated. So when the patient is seated, make sure the head and the back is rested and then it is in upright position. And always just briefly describe the procedure to the patient. So what are going to be done, and then taking for maxillary teeth, always down the chair as low as possible, and for mandibular teeth, slightly elevate the dental chair. And while taking for the maxillary radiograph, always make sure that the mid-sagittal plane it is vertical and the occlusal plane it is horizontal. And for mandibular teeth, you slightly lift the head in order to compensate the changed occlusion when the patient is opened the mouth. So these are the first fundamental rules to be followed. And the second one is set the X-ray machine settings, that is in regard to the KVP, MA and exposure parameters as per the guidelines and the recommendations given by the manufacturer of the film. And the third one is position of the tube head. So always the tube head has to be positioned to the side of the radiograph to be taken, so that it is readily available whenever the patient, after the patient placement of the film. And the fourth fundamental rule is that examine the oral cavity. So always ask the patient to open and examine the oral cavity for their axial inclination in order to modify the film placement, and also any obstacles like your tori or any maxillary tori, mandibular tori. So that has to be taken care while placing the film. So that will modify the placement of the film. And the next fundamental step is that, and then placement of the film. So placement of the film. So this is an intraoral periapical radiograph, and this is the film holding device which is called as a snap array used for the bisecting angle technique. So here one more rule to be followed. So always when you are keeping the intraoral film in the oral cavity, so it has non-color coded side, that is white surface, and it has the color coded side. So this color doesn't have any significance, it is a manufactured deciding factor. So always the white surface or non-exposed white surface has to be towards the X-ray tube. And while placing the film in the oral cavity, always remember there is a raised dot or knob on the corner of the film. So this raised dot or knob should always face the incisal or the occlusal surfaces. And this is the film holding device which is called as a snap array, which is used for the bisecting angle technique. So when you are using this snap array instrument, so always make sure this is the broader surface towards the buccal surface. So wherever you are using, if you are using on the left side, so this broader surface towards the occlusal, towards the buccal surface, and if you are using on the right side, so this should be towards the buccal surface, so that the patient will going to bite on this occlusal table. So this is the fundamental rules to be followed. And finally, then position the tube head towards the the area to be radiographed, and then finally expose the machine, so according to the preset parameters. So these are the 7 fundamental rules to be followed to making an ideal radiogram. So now let us discuss the different projections, intraoral projections are of different teeth. So always for the maxillary teeth, as I said, so patient position, like the mid-sagittal plane should be horizontal, vertical, and the longest occlusal plane should be horizontal. And while making for the maxillary central incisors, so always, as I said, the raised dot or knob towards your exposure side, and this raised dot or knob towards the incisional surfaces. So this is how you have to place the film. And while placing the film in the intraoral cavity, so always for the maxillary teeth, so, and one more fundamental rule is that, so whenever you are taking an intraoral periapical radiograph, the region tooth should be exactly in the center of the film. So when you are taking for the maxillar central incisors, so place the film in such a way that this raised dot or knob towards the incisional edge, and always the inferior edge of the film, it is always 2 to 3 mm beyond the occlusal or incisional surfaces, so that the incisional surfaces or occlusal surface will be incorporated in the radiograph, final radiograph. So this is how you need to place the film for the maxillary anterior teeth. So once the placement of the film is done, then ask the patient to slightly down, that is make the occlusal plane that is horizontal, and then on the X-ray tube, so as I described, so we have different angulations which are already prefixed on the X-ray tube head. So we have 0 and then followed by positive vertical angulation, and then 0 and then negative vertical angulation. So always for maxillary teeth it is positive, and for mandibular teeth it is negative vertical angulation. So now we are going to point out the projection for the maxillary incisor. So after the placement of the film is done, for the maxillary incisor, the point of entry of a central X-ray beam through above the level of the upper lip, that is exactly in the midline, just below the septum of the nostril. So that is the point of entry through the upper lip, exactly in the midline. So this is how the point of entry has to be for maxillary central incisors. So for maxillary lateral incisors, again the placement of the film is same, and exactly the region of interest should be in the center of the film. So this is how the placement of the film is done, and ask the patient to hold with the index finger or the thumb for the maxillary anteriors. So once the placement of the film is done, then again adjust the vertical angulation, that is plus 40, and then the point of entry is again it is similar to the central incisors, that just above the level of the upper lip, just 1 centimeter from the midline. I am repeating, just above the upper lip and 1 centimeter from the midline is the point of entry for maxillary central incisors. So this is how the point of entry for the maxillary central incisors. And coming to the maxillary canine, so again the placement of the film, exactly the region of the tooth should be in the center of the film. This is how the placement of the film should be, and once it is done, and then holding the film with the patient index finger or thumb finger, then adjust the cone and vertical angulation. For maxillary canine it is positive 45 plus 45 degrees. So adjust the vertical angulation. Now the point of entry of the central X-ray beam is that, if you look at the ala of the nose, the patient ala of the nose, the distal most part of the ala of the nose and the intersection of the distal and the inferior border of the ala of the nose, so that intersecting point should coincide with the central X-ray beam. So now for maxillary canine, always consider the distal and the inferior border of the ala of the nose. Adjust the vertical angulation to plus 45, and then the point of entry through the intersection point of distal and the inferior border of the ala of the nose. So this is exactly the point of entry for the maxillary canine. And now coming to the maxillary premolar. So for maxillary premolar, always place the film in a horizontal projection. So horizontally place the film, and see to that the raised dot or knob towards the occlusal surfaces, and the region of the tooth should be exactly in the center of the film. So for this you need to use a snap area for the maxillary and mandibular posterior teeth. So this is how you need to hold the film with the snap area, and then ask the patient to open the mouth and then keep exactly both the first and second premolar should coincide exactly in the center of the film. So once it is properly kept, ask the patient to close the mouth and bite on the table of the snap area, and then adjust the head just exactly upright, and then the vertical angulation for the maxillary premolar is plus 30 degrees, and the point of entry of the central X-ray beam exactly just below the pupil. So this is the pupil of the eye. So exactly the point of entry just below the pupil of the eye, and at an angulation of plus 30. So this is the point of entry just exactly just below the pupil of the eye. So directing towards your second premolar and first premolar. And the same principle again for the maxillary molars. So placement of the film is same, like raised dot which is towards the occlusal surfaces, and then ask the patient to wide open and insert the film which is covering the first and second and third molar. So once it is properly kept, ask the patient to bite on it. So once it is bite, then the patient head should be adjusted in the upright position and adjust the angulation. For the maxillary molar, the angulation is positive, that is plus 20. So the point of entry of a central X-ray beam through the outer canthus of the eye. So this is the outer canthus of the eye. So this is the outer canthus of the eye. The point of entry at an angulation of plus 20, directing just below the outer canthus of the eye. So this is the way of projection for the maxillary molars. And now coming to the projections for the mandibular teeth. So always for the radiographs for the mandibular teeth, so slightly raise the head or tilt back, so that in order to compensate the changed occlusal plane when the patient is wide open. So and then for maxillary mandibular central and lateral incisors. So while placing the film in the mandibular central and lateral, so since it is a very narrow arch, so in order to follow that curvature, you just slightly bend the film. Okay, so while bending the film, just keep your index finger and slightly bend. So it should be an obtuse bend. Okay, so you should not have an acute bend. So that will going to again form a dark line on the exposure film. So always you should have obtuse bend, slightly bend the film in order to compensate the curvature in the narrow arch in the mandible. So once it is done, ask the patient to open and then keep the film and make sure the raised dot or knob towards the occlusal or incisal surfaces. So this is how the placement of the film should be. So slightly tilt the head in order to compensate the changed occlusal plane, and then so once it is done, the point of entry of the central X-ray beam at an angulation of minus 15 degrees, the point of entry just below the lower lip, so directing towards the film. So this is the point of entry for the mandibular central and lateral incisors. And while taking for the mandibular canine, so the placement of the film is like exactly the canine should be in the center of the film. So here also you slightly bend the film by supporting your index finger, so that it will follow the curvature of the arch. And this is how the placement of the film is. So once the film is placed and then hold it by the patient, now adjust the vertical angulation. The vertical angulation for mandibular canine is plus 20. So plus 20, and the point of entry is just above it is perpendicular to the ala of the nose. The point of entry of the mandibular canine exactly perpendicular to the ala of the nose, and then 3 centimeter above the inferior border of the mandible. Okay, I am repeating again. So it is perpendicular to the ala of the nose and then 3 centimeter above the inferior border of the mandible. So this is how the projection is for mandibular canine. So that is, your central X-ray beam is perpendicular to the alar of the nose and just 3 centimeter above the inferior border of the mandible at an angulation of -20. And while taking for the mandibular posterior teeth, again you need to use snap array and see to that the occlusion, this table should be on the buccal surfaces wherever you are keeping, and make sure that the raised dot or knob towards the occlusal surface. So while taking for premolars, and make sure that both the premolars exactly coinciding in the center of the film, and once it is placed, ask the patient to bite and then adjust the vertical angulation. For mandibular premolar it is -10. So the point of entry for this mandibular premolar is through the just below the pupil of the eye, and 3 centimeter above the inferior border of the mandible. So this is how the point of entry for the mandibular premolar, that is just below the pupil and 3 centimeter above the inferior border of the mandible, and that should be the point of entry for the mandibular premolar. And for mandibular molars, the same placement again, and then see to that the molars exactly in the center of the film. So once it is properly positioned, ask the patient to bite and then adjust the height. And now the vertical angulation for mandibular molar is -5 degrees. So adjust the 5 degrees vertical angulation, and the point of entry is just below the outer canthus of the eye and 3 centimeter above the inferior border of the mandible. So that should be the point of entry for the mandibular molars. Just below the outer canthus of the eye and 3 centimeter above the inferior border of the mandible. So this should be the point of entry for the mandibular premolar. So this is how you should follow the projection for all the teeth. So once it is properly positioned and suited, so the radiograph should be taken, and this radiograph should be properly washed and dried to ensure proper film processing. So if you are following all these fundamentals, rules and the position for taking maxillary mandibular radiographs for bisecting angle technique, so you will get an ideal radiograph and which is a diagnostic image. Thank you all.